Um, yeah, everyone who is joining as a audience member is muted as you come in. And we'll talk about how to do questions in a little bit, or in the introduction. So let me go ahead and get started. Hi, everyone, again, and welcome. My name is Jane Burke-Miller, and I am a Senior Mental Health Training and Implementation Associate at the Center for Psychiatric Rehabilitation at Boston University, and the moderator for today's Making Sense of Employment Research webinar. The webinar is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. The webinar content does not represent the views or policies of the funding agency, and you should not assume endorsement by the federal government. The territory on which Boston University stands is that of the Wampanoag and Massachusetts people, and we honor and respect the history and current efforts of Native Indigenous communities. This webinar is being recorded so that you can access it later. Also, closed captioning has been turned on, and you can access this by clicking the button at the bottom of your screen. In case this is your first webinar with us, I'm going to introduce our speaker. They will share their research with you, and then we'll have a question and answer session at the end. If you have a question during the presentation, please post your question in the Q&A box or in the chat box, and I'll pose them in the order we receive them at the end. If you have a technical question, please send a chat directly to me using the chat feature. Also, we'd greatly appreciate your feedback about this webinar, so there will be a survey posted at the end of the session. Today, I'd like to welcome Dr. Liz Siantz, who will be presenting her research paper, Once a Peer, Always a Peer, a qualitative study of peer specialist experiences with employment following state certification. This presentation qualitatively explores recently certified peer specialists' experiences with navigating the job market to find post-certification employment, experiences with employment once in the workforce, and reflections on CPS training. Liz is an assistant professor at the University of Utah College of Social Work. Her research aims to improve health equity and quality of life among persons with serious mental health conditions and substance use disorders through the implementation of self-management education, integrated behavioral health services, and peer support specialists. She is currently PI of KO1 Award from the National Institute on Drug Abuse to study the adaptation and implementation of a peer-led chronic disease self-management program for primary care patients. We are excited to have you here today, and welcome, Dr. Siantz. Please go ahead with your presentation.
Thank you so much for the introduction, and hello, everyone. Thank you so much for having me. I'm very excited to be here. I am a longstanding ally of peer support specialists and researcher in peer support specialist services and employment experiences. This work has gone on for me for the last 15 or so years, much of which can be found on Google Scholar and PubMed, so I won't belabor the nice introduction that Jane just gave me. So with that, I will continue if I can. There we go. So this research that I'm about to present was supported by the National Institute on Disability, Independent Living, and Rehabilitation Research. The PI of this project was Dr. Leisha Ostro from Live and Learn Incorporated. This work is also supported by my KO1 from the National Institute on Drug Abuse, etc. So I'd also like to acknowledge the study team before I begin. Again, the PI, our co-investigators, Drs. Mark Salzer and Judith Cook, and I'd also like to acknowledge our interdisciplinary team of graduate students representing social work, medicine, and community psychology. So what will we cover in today's talk? We're going to talk about why we would want to study certified peer specialists, particularly early career ones, and think about really what is unknown, right? We'll go over a qualitative exploration of early career CPS experiences with employment. And then we're going to go over some other lessons learned from this qualitative research. Serendipitously, the results from our longitudinal analysis were accepted for publication just a few days ago at Substance Use and Addiction Journal. So I'm really eager to share the follow-up from that first round of data collection. And then I'm going to conclude with some action-oriented next steps. So I imagine a lot of people here in this audience are already aware of what exactly is a certified peer specialist. But just to ensure that we are on the same page with respect to language being used, I will say that a certified peer specialist is, generally speaking, a person in recovery from a mental health or substance use disorder who has completed specialized training and are certified under state standards to provide peer support. CPSs are often employed within mental health and behavioral health systems, and they provide peer support by sharing their own lived experiences, woven in, right, with different types of instrumental and social supports. Rooted in the idea that people who share experiences, similar experiences, particularly recovery experiences, among others in this context, can offer health too, and validation, information, et cetera. And I'd also want to add that the CPS certification serves other purposes, such as Medicaid reimbursement for peer-based services, which is typically contingent on state certification. And certification also supports the standardization of peer support specialist training and services, and kind of ensures that peer support positions are held by those with appropriate lived experiences and other experiences. So another important question would be, why would we study certified peer specialists early in their careers? Right, so, generally speaking, it's important to study certified peer specialists because, people in recovery experience barriers to securing and maintaining employment, workplace discrimination, longer periods of unemployment, lower levels of educational attainment, health-related challenges, et cetera, which can contribute to low labor force participation. So focusing on early career CPSs can generate knowledge on how to support certified peer specialists as their careers launch, right? And it can really maximize coming together and to understand their experiences and challenges and successes can help the field, providers, researchers, et cetera, work together to maximize the contributions of CPSs, of these valuable providers at the start of their careers, and which can also support workforce retention. Okay, but what is unknown? Okay, so little's known about how CPSs experience that transition to the workforce following certification, and how the challenges that might come up, that some of which are known in the literature, might impact CPSs early in their career, but like, how do they play out over time within that first year of their career and longer? Um, and and also, what else do early career CPSs have to say as they embark at their beginning of their careers? So in this qualitative study, we explored recently certified peer specialists, CPSs, with their experiences in navigating the job market and finding post certification employment, their challenges and successes with employment once in the workforce, and also their reflections on the utility of CPS training. So data were collected in the fall of 2020 as part of a sort of a sub-study, you could say, of a parent study that was a multi-state 3-year observational prospective cohort study of newly graduated CPS's employment experiences. And the participants from the parent study and then subsequently the qualitative study were recruited, enrolled from 4 states representing the West Coast, the Southwest, the Southeast, and Northeast US regions. As far as the qualitative, sampling approach goes, we used a maximum variation sampling approach. And so that means that we intentionally wanted to sample people that had a wide range of geographic locations, employment experiences. So we were equally interested in people that were unemployed and employed. And this information was gathered according to the parent studies survey. So data that were captured through that parent study. So we recruited directly from the parent study. And so this study includes 25 early career certified peer specialists from a range of regions with a range of backgrounds and experiences. So qualitative interviews focus on participants' experiences looking for work following certification, their current employment, how they felt about the employment. Were they having a good time? Were they not having a good time? And then also their future goals. Data were analyzed using constant comparative methods. This is just some information about how we developed our themes. This analysis for this first wave of data was primarily conducted by myself and Morgan Pilote, where we co-coded transcripts. And once we reached a high level of agreement, we then each coded the remaining separately. And I also want to highlight that the interviews were conducted and in fact developed by a team of researchers that included peer advocates, recovery experts, and individuals with lived experience. So that is at the core of this research. It was a collaborative effort with regard to different types of expertise on the subject matter. And so some example questions that we asked were, how did you come to this job? Does your employer support your work as a peer specialist? Can you tell me more about that, right? So we had all these probing questions to help us understand like how people got there and how it was going. And then importantly, we were also very curious on how the CPS training and certification influenced just their trajectories to this job and how. So, okay, in terms of sample characteristics, note that 25 of our sample of 25, most were female, most were white, with secondly, I guess, or Black. And then employed, there were about 60% were employed, so 15 were, but 13 had ever worked in a job that required a CPS certification and had actually worked in that peer support role with an average age of 28. And other racial ethnic groups included in the sample, or represented, I guess, in the sample included Latinx or Hispanic, Asian, and also Native American. Oh, and then we had a decent representation of the, the US regions from which we recruited, with slightly lower, I guess, from the Pacific Northwest. Okay, so I'm going to present 3 themes from this first wave of qualitative data. And so the first was just the general theme of searching for employment. So just know that a lot of people in our sample were challenged to find work when applying for CPS positions and had to apply for many, many jobs before they were eventually hired. And this is true for regardless of employment status. I feel like many people that were not employed were in the midst of trying to apply for jobs and were hoping to, in fact, eventually secure one. So what undermined finding employment? And I think that this is something that just came up, that there appear to be in these regions limited availability of CPS positions, right? So there is, and one person phrased it as, well, it's an industry that's not hiring. And so there was just some challenge with that a lot of people are getting this certification, but there are not sufficient number of jobs to place folks. Another challenge to finding employment was that there was a feeling that positions don't actually reflect CPS skills and values. So as one individual commented, so during the job interview, they mentioned taking people to their appointments, like doctors and psychology, and they offered the position. And I said, so how much of this job is actually driving people places? And so I would have been in the car like 5 or 6 hours a shift. So I was like, okay, so are they hiring me to be a taxi driver instead of doing things that are actually beneficial to people? And so I actually turned it down. And then another person, there was also some financial considerations, that there was just some low pay. There are also some challenges related to the health of the study participants that undermined their ability to work in a CPS position. And so what facilitated finding employment? Well, networking within the peer support community, and going over and over to meetings, and another person didn't get a job until was only hired after the person who held their position previously passed away. And so there was a lot of persistence that basically had to occur prior to being offered a CPS position. Okay, and so among those that were working, or eventually were working in a CPS, or had experience, I guess, working in a CPS position, one of the things that impacted their experience sort of negatively even, was when moments when leadership of an organization didn't have the skills to work with certified peer specialists. So, as one person said, they still don't look at it like it's a real thing or a real job. Oh, they're just a peer. They're not a clinician. They're not this way. They're not that. They don't really matter. Something that could impact a person having a positive experience with a job was supervisors that create a culture that is supportive of CPS work. So a couple people commented on, relayed moments when their supervisors were supportive of their pursuit of, additional training, supportive of creating an inner office culture, I guess, where everyone is like able to work together and is uh, everyone's able to work together, collaboratively, and communicate as is often necessary in community mental health and recovery settings. And then, of course, there were general relationships with coworkers, right? So there were people who were there were some negative relationships with coworkers, and then there were some extremely positive relationships. And then one individual who held a state level position in a state, can't say what, there was working in a state level position, and was very, very proud of the position that they're in, the influence and the impact they were able to have at a higher level to, affect a higher level of change. And according to this person, there were people that were very unhappy that I was there. They thought it was not fair that somebody with no college degree or license, or it was wrong to be paid what I was paid. So that was something that came up. And then positive, there were people that felt respected. I feel respected. It's actually been a long time that I've been very happy at a position where I have a team that I can count on. It really means a lot. Let me see if there's anything else I want to say about that. Okay. And then the value of the CPS training and credential. So it's interesting that the utility was debatable. To be frank, it was debatable for some, but it was helpful. Some felt that it was helpful to create a profession, right? So some people felt that like the content of the training wasn't actually that helpful. It was more like, right, so I'll just read the quote. The content of the training wasn't super helpful. It was more kind of what the broader meaning of getting certified meant. So it's a real workforce, right? So it's creating a workforce rather than giving like individual skills, I think is something that was frequently heard, repeated in these interviews. We're creating a discipline that's creating a profession. So I think that was very significant. On the other hand, people were still felt unprepared for much of the minutia, I think you could say, that comes along with these types of jobs. So for example, the training was great, but I'm not really sure it prepared me for working because the case notes. And so people would say, one person I remember saying, I don't write clinical. So just some of those logistical things, or some people might not have computer skills. So it's something to consider. But still, many participants held being a peer in very high regard. And as one person knows, this is the title of the presentation, I kind of feel like once a peer, always a peer. I mean, you can never really take off that hat. It's just kind of who you are. And then what else? There's another one. And so as I've mentioned, some people were working in peer roles and some people were not. And so one person who was working in as a 911 dispatcher also felt that there was, the utility of it was 50-50 maybe, but also noted that the skill of de-escalating an individual in a crisis is something that can really transcend a lot of different types of jobs. And so there were skills that came up that were very useful. Okay, so that's round one here. So this was all great information to have, right? A lot of the reasons why finding a job was challenging, that that many workplaces were not equipped to work with peers, that the CPS training was useful in some aspects, but there were opportunities for growth in other aspects. But questions remained from this data. And so we were fortunate under this NIDLR project that we were given the opportunity to collect a second wave of data to follow study participants 1 year later. So how were they doing 1 year later? And how did they view their CPS credential? How did they feel about their jobs? How did it all shake out for them? Okay, and so these results are from, as I said, a recently accepted paper, Employment Trajectories of Recently Certified Peer Support Specialists, a longitudinal qualitative analysis. So this study asked, how did employment change over the course of the first several months post-certification? What were the circumstances that led to these transitions? And I also just want to note that community, as many in this audience are, I assume, aware, community-based research of this nature is messy. And I will, right here at the beginning, just say that despite our numerous attempts at study recruitment, there were 13 individuals that out of our original 25 that opted into a second interview. And so I will just say that a main reason why, as far as we understand, people were not able to participate in a second interview was because quite simply put, demands on people's time. Also, from our second round of qualitative interviews, there were people that opted out were more likely to be employed working as a CPS and were presumably too busy working as a CPS. I don't know, maybe that wasn't why, but just coincidentally, that was the characteristics of the people that were not that opted out of a second interview. Okay. So each participant from the first round was invited to participate in the second round. People were, I don't remember if I said this earlier, given $30 to participate, and were given $30 again if they did. These interviews focused on, again, the employment experiences and professional transitions since the first interview. The follow-up interview, some example questions from the follow-up interview guide were, are you currently working? Have you changed jobs since our last interview? And then tell me more, right, about what led to your job change. And so also just by way of explaining how we analyze this longitudinal data, we utilize the longitudinal case study approach. And so we organize results according to who was working or who was employed and who was not employed 1 year later. So we put the transcripts in two different piles, not employed at the end of the day, employed at the end of the day, and we looked at both waves of data to see what was going on within cases, right? What changed at the individual level, who changed jobs, who didn't, and then across cases, what can we say about people that were working at the end? What thematic statements can we make? And what can we say about people that were not employed at the end of the day? So hopefully that explanation of a longitudinal case study makes sense. Everything was kept track of on Excel files. I'm happy to discuss at the end. Okay. And so, okay, so again, focusing on individuals that were employed as a CPS 1 year later. So there were 5 individuals who were working in CPS positions. And starting with their baseline interviews, because again, for the longitudinal work, we looked at both sets of data. These individuals were actually super optimistic. Most of them, nearly all of them, were also employed as a CPS at baseline and described being very passionate about their job. Was one individual noted, "I love my job and I love my people," right? Some people noted that they were maybe a little bit intimidated by working as part of maybe a big clinical team or working on a research grant or something like that. One person mentioned, it's a huge responsibility and I don't want to mess it up. Again, yes, so 4 of the 5 individuals were working as a CPS at the baseline interview. And these individuals were also positive at follow-up. They had a positive outlook on their agency. Peers are looked highly upon, even though there were some, upon reflection, some things came up that were, challenging. But it ultimately did not override just how people felt about their work, about the importance of the work they do and the pride and joy that they take in doing it. But again, a challenge though. When I came on, it was only me. I would say that they didn't do a lot of things right. My office was originally on a different floor from the rest of the behavioral health team. Um, in a closet kind of thing. It was in an office, but took a long time to get the badge. And this person felt that these are things that could be considered microaggressions, which is a really big deal. So there was optimism, but it was mixed. It was mixed with right with challenges. Okay, so who was not employed as a CPS 1 year later? Okay, and I also want to clarify as I'm talking that there are people in this group, in these 8 people, that some were employed doing other things, and some were fully unemployed. So I just want to make that caveat that everyone who is not working as CPS was grouped into this category. Okay, so not employed as a CPS at baseline. Again, challenge to find work. That did happen, but some had positions but left because of burnout at baseline, before their baseline interview, right? So I was experiencing burnout with the staff that I was working with. Also, I ended up going on disability because I just didn't do well there. And many had goals to get a CPS job during their baseline interview. My goal right now is to get a CPS role. I would love to work full time. I want to work with adults in a hospital environment. I know that I want to work with adults. Okay, so, and then other challenges were, uh, uh, like I said, some alluded to anyways, maybe some exposure to trauma, some situations with their health that undermine people's ability to do this type of work. And then at follow-up, there were people that were rethinking their future as a CPS at follow-up, right? So some people had opted out kind of permanently. Some people were still thinking maybe they would do this, would do CPS work at some point. And so rethinking future, they were kind of rethinking it at the end of the day. So one person mentioned, I don't want a CPS role because of the pay. And one of the things that became obvious to me through that experience is that I have a lot of potential and I have a lot to offer. And it felt like to be in that role, I had to dumb myself down and make myself small. And so this is an individual that did have a CPS job, I think briefly between the 2 interviews, but I thought that was a very impactful quote. And then another person commented, I was just so distraught that I turned off and turned off with what happened that I just wanted to be done with peer support altogether. Okay, so this is a diagram. I'm going to walk you through this. But I first want to thank Morgan Pillow for putting this together, and my anonymous reviewer at Substance Use and Addiction Journal, who requested it to go along with our longitudinal results, because I think this really spells out nicely what happened, what are the change in our sample from the beginning, the first wave of data and the second wave of qualitative data collection. So I'm going to walk you through. I'm going to start at the bottom. Okay, so we had 5 individuals unemployed at baseline. And then reading left to right, at follow-up, 4 of those individuals remain unemployed. And then 1 individual moved up into the employed as non-CPS at follow-up. So then we had 4 individuals that were employed as a non-CPS at baseline. And then 3 of those people stayed employed as a non-CPS at follow-up, and 1 moved up into that employed as a CPS at follow-up. And then 4 were employed as a CPS at baseline, and then stayed employed as a CPS at baseline. So this just gives you like the real breakdown of how our study sample fared over time, over that first year. Okay. I'm just doing a quick time check. Oh, it's only 10:30. Okay, so I do have a couple of discussion slides, but those are going to be to transition us into our conversation. And so instead of segueing into that this minute, I'm just going to, some strengths and limitations. Okay, so study, it included the experiences of 25 individuals with a range of experiences in geographic locations. We sampled for that range of experiences, and then we had 13 people that we spoke with again to understand how these challenges and successes played out over time. Of course, the results cannot be actually generalized given the nature of qualitative data. And then I also think that it is important to acknowledge that these data were collected, the first wave anyways, of data were collected during the original COVID-19 lockdowns of 2020. I can't remember if I mentioned the date when I was in the method section. So, that really might have impacted, it very, very likely did impact people's experience with searching for and navigating employment, especially given like when we did this in summer of 2020. And so it is interesting that, in the second wave of data, like the consequences and the impact of COVID, I feel like by the time we got to 22, 23, people weren't actually really talking about. And yeah, so anyway, that was just a standard caveat. And then again, I mean, community-based research is messy, and it would have been fantastic to see how the qualitative data played out over time with all 25 members of our sample, a larger qualitative sample, that, there are all kinds of ways that this could have been larger and better or whatever. But I think that there are a number of strengths in this study, and talking with people over time, hearing about a wide range of experiences is among them. Okay. So I guess I have a lot of discussion. So I have 2 discussion and implication slide. One is practice related. One is more pertinent to research and scholarship. But I think that I want to start on a high note here. I mean, first of all, so despite the big range of experiences to the workforce, many that were, regardless of employment status, held the CPS credential in
Oh, you froze for a minute, Liz. Can you hear us, Liz? Still frozen. Oh, oh, there you are.
Oh, good.
You were
Okay.
frozen for a minute.
Oh, okay. Uh, let's try that again. Hopefully everyone's, oh, I see that there are still 56 participants, so,
Mhm.
um, okay, let's try that again. Sorry about that, everyone. Now, where was I? Um, okay, so people spoke uh, spoke about their lived experience and their work as a peer in the highest of regards. And I think this is where I got frozen, that we just also had a second paper from our first wave of qualitative data accepted for publication that explores how people use and expect to use their own lived experience. And that this theme is really explored in that paper. So be on the lookout for it. Okay, so one of the things that came up from this, from like from the practical standpoint, is that there are opportunities to strengthen the utility of the CPS training and certification, right? There's a range of employment, there's a range of things going on with people that participated in this study. But one thing that might be easy enough anyways to do could be to match could be to match people that are completing the CPS training with organizations that are looking for people to that are looking to hire a peer support specialist. That might be something that's already taking place in certain places, and I'm not aware of it, but it seems like something that could easily, it's like an actionable step that could happen. Or maybe even, including like a peer, like mentoring of a peer mentor to help navigate the job market. Just something practical suggestion that came up from this, emerged from this project. And then also, preparing trainees for office skills they should expect to need, paperwork, case notes, computer skills, and then just navigating workplace challenges that peer support specialists are known to encounter. And I hope that suggestion doesn't come across as this is like, well, the peers should do something different, not the workplaces, because the workplaces should do something differently too. So suggestions to improve the work experience, right? The regular supervision, maybe from others who are certified peer support specialists, is something that could keep people caring for their wellness and recovery, given that people are still, these are ongoing processes, right? And that self-care is very important to maintaining recovery. So again, access to supervisors who also have recovery experience and can protect that authenticity of the peer role. And then thinking about how to intervene when recovery and health status undermines workforce participation. And thinking about how virtual peer support services could increase technological access and technological skills for peer specialists and provide job flexibility and accommodate health and recovery needs, which is something that came up a lot, something that came up in these data, right? That there are health and recovery needs that can, and moments, present challenges to fully maximally participating in a workforce the way somebody might want to. And then, to finish on implication for research and scholarship, peer-to-peer models of supervision are happening in practice settings that I work with here in Salt Lake City. I'm working with one peer-run organization to formally develop and manualize their model of supervision so that it can be tested elsewhere in support peers that are in the workforce. But there's that I'm aware of, and I would love to know if others are working on this. This could be something that should, I mean, these models though should be empirically developed and tested. And in thinking about the different projects I work on, this would be an ideal opportunity to work on to support peer support specialists working in culturally responsive settings, working across cultures, which I didn't present on here, but that is something that came up in what people would say about the CPS training, that it didn't really prepare them for working in cross-cultural situations or cross-age situations, et cetera. And then understanding, and it can also help people kind of understand differences in recovery experiences, whether recovery from substance use disorders, from mental illnesses, from other, social things that people have encountered. And then again, virtual peer support is something that I think would be really wonderful to study. And I'm also aware of a small body of research on that topic, but I'd be curious if this is something that people are working on. Again, I think I already said this in the implications for practice slide. But I also just wanted to say that both of these areas it seems obvious that peer-to-peer supervision would be helpful. It seems obvious that virtual peer support would increase availability of employment and peer support services. So this might benefit from an implementation science lens. And so in thinking of that, it's like, is it possible to implement these things? What are the considerations for implementing them in different types of organizational settings and clinical settings? Like what would it take to implement peers telehealth services, peer-to-peer supervision services? Okay, so, and then, I mean, that's really it. I'm gonna end on a quote. I just want to, I hope that I've conveyed the, uh, the spirit of this work. I think that these individuals, these people that participated in these interviews were so forthcoming and so open about sharing their experiences, and they had just had a lot of heart, and I want to convey that. Um, and so, as one person said, peer support is how they were, referring to, the field. It's like a family. You kind of help each other and tell each other. It's part of you that you kind of share each other. It's not all just the job, job, job. The client will support you and you will kind of learn from each other. And that is very meaningful. And it is sort of the essence of what I've learned about peer support work from learning, from working in this space over my career. So thank you very much. Some papers from this study, and I'm happy to continue, answer some questions, continue the conversation.
Liz, thank you so much. I know it's hard to convey detailed qualitative information
Yeah.
in slides, but that was great. So let me go through first we've had a lot of comments, but let me go through the Q&A first, and then we'll go through the comments. So the first Q&A was more of a comment that part of the problem from my peers is not being able to find part-time jobs due to their mental health in California. Cal MHSA is investing 5,000 California Medi-Cal peer support specialist certifications, but jobs have not been expanded, and counties have not been included, have not included peer workers in county behavioral health that currently do not have peer programs, whether it's contracting out. So the state is shifting with focus on community health workers and wellness coaches. That's interesting. So some different things happening in California. Stephen says, is there a work experience component in addition to the training for certification? And, every state is different.
I believe there's a component for recertification so that you can stay certified. But yeah, every state, thanks, Jane. You might be able to answer this better than me, but as far as I know, that it varies by state.
Yeah, and they definitely don't all have it. There are new SAMHSA guidelines, and I'm not sure if there's any guideline about work experience. N was 25, these add up to 13. There was some dropout between the first and second interviews.
Yeah, there was some dropout, yeah.
Were peer specialists included in the development and implementation of this study?
People that have formerly worked in the role of certified peer specialist were part of our team, yes.
Yeah. So let me, we had a lot of comments. Thank you, everyone. So I'm going to start scrolling through.
I'm glad to share the slides, but I also just want to say that there are 3 publications one is out in the literature and 2 more are on the way. So that explains everything in greater detail and clarity than the 40-minute version here. So.
Yeah, and if you can't access the articles, you can get in
Absolutely.
touch with me or Liz, and we can send them to you.
And I'm happy to share my my email. It might be on the flyer, but I can just type it here. I did see that.
I wish peer support specialists were valued more in the mental health care systems. I've been in the PSS community for more than 10 years.
Yeah,
I think that came out in some of what you were describing of the microaggressions of somebody starting
yeah.
a job and not being kind of treated as an equal.
Being put in a closet instead of with the rest of the team. That is unacceptable. That's unacceptable to say the least.
Here's someone, or maybe the same person, I'm not sure, being excluded from a mental health panel for not being a mental health licensed clinician, which is weird because certification is certification. But again, I think that speaks to maybe the not having the
Panel.
recognition.
Yeah.
Bad bosses, yeah. LA County Department of Mental Health only paid PSS workers $16.67 an hour until I advocated for higher pay. I think that's a constant problem. It's in one of the quantitative studies, it was found that certified peer specialists on average made less per hour than sort of equivalent community health workers with the same kind of training. Many trainings are still personal development instead of work prep. It would be great to have role-playing scenarios in trainings. Real-world experience with a client as a newly trained PSS can be very daunting. Yeah, and that kind of came out too with at least practice interviews, mock interviews, and so on. There were some questions about the participants, but we had that. Here's a resource. When there's a crisis, call a peer. How people with lived experience make mental health crisis services more effective, by the Bazelon Center for Mental Health Law. Thank you. So I think we addressed how many people were in the sample. And again, it was sort of a specific subsample of a larger study.
I see that Lynn Laguerre has her hand raised. Is there a question or comment you'd like to make?
Linda's one of our colleagues here.
Hi there. Liz, thank you so much. Any validated research that gets published about peer support is so valuable because if it's not in the literature, it's really hard to build on it. So thank you for doing that. I trained, oh my God, your colleague. I just had a mind fart. Live and learn.
Leisha?
Yeah,
Yeah, yeah.
she's the best.
With training CPSs.
Mhm.
I just wanted to validate a lot of what you're talking about. We did a coaching program to coach peer support specialists
Okay.
working out in the field, right? So they got coaching services, and the coach was somebody who had worked as a peer support specialist, so knows the role, and then had coaching training on top of that. And all of these things, as also the chat courses, validating all of these work challenges and training challenges
Mhm.
been present since the beginning. You know, but
Exactly. That's also my understanding. So I mean, I,
since day one,
mhm.
peer, like having peer workers move into a supervision role and then supervise other peer supporters. Still not
Yeah.
going on very much. It's the obvious way to go, but it's still not being raised.
I'll just share that I work with a wonderful organization here in the state of Utah called Latino Behavioral Health Services. They are Utah's only peer-run, Spanish-speaking peer-run behavioral health organization. And their model of supervision and the way that they operate is so needed. And I'm excited to work with them and share more, work with them to share more about how they operate. Because
What's
it's
hard is
something
getting that
that
from peer
I haven't heard of really. Sorry, go ahead.
what's hard is getting that from peer run orgs into the behavioral health, where the majority of the jobs are in the more traditional behavioral
Yeah.
health. So, but it's great work. I just wanted to validate it and thank you for
Mhm.
doing the
Thank
work
you.
on
Thank you.
conversation.
There was a follow-up question to the peer specialists being included in the development and implementation of the study. More
Okay.
detail about the inclusion of lived experience. I mean, the principal investigator, Leisha Ostro, is a researcher who identifies with lived experience. So she's a peer researcher and does a lot of interesting work. And some of the other people working on the study and then there was an advisory committee of people with lived experience, I think, who reviewed the research protocols. So that was Emily's commenting on having experienced burnout, which caused her to not want to work with humans anymore, doing cat rescue instead, which is great. Please share what that was important to in the development, why that was important.
I'm not able to see well, I have the chat up, but
This is in the Q&A.
yes, organizations who hire and I think that absolutely organizations who hire CPSs should undergo training, and I think that that is it's one of those things that could have a home both with the mental health uh, policy and clinical organizations and academic researchers, because that is exactly how, the challenge of how we implement, to use the academic word, peer support specialists in across different types of settings is a long-standing challenge. And one of the main challenges is that people don't understand the role. They don't know how to work with people. They don't know how to work with someone who has this type of expertise. And thus, if they're not able to support this person. And so I think that that is an absolutely viable and critical next step. And so I very much agree with that.
Looking at some comments about part-time, because of burnout and stressors of the work, the part-time work can be beneficial. Also some interest in doing peer support virtually. Some of the comments are excited about that. I mean, I think, and you could speak to this, but I think there is a great place for that, especially now you see these great platforms for all kinds of mental health services that are done remotely, and I don't think peer support should be left out of that. I know sometimes some peers feel like you can't, it's much more effective to do it in person, but I think there's room for a variety of formats. Let me see what's going on here. Questions. Would love to hear why it was important to you to include lived experience in such a way and the benefits of it. In the design of the study, I think. I mean, that was up to the principal investigator.
Please share what was important. Well, I think for this, one of the ways that lived experience was used was to understand what questions to even ask. What would someone who has either lived experience or has themselves worked in the area of peer support as a peer support specialist know about career transitions, what to ask about the training, and how, what would we even ask? And so that's one of the ways that lived experience figured into the development of the interview guide for this study.
Yeah. So I don't know, Liz put her email in the chat. Did everyone see that?
It's been put in the chat
A couple times.
a couple of times.
Put on the slides, and will the slides be available? That may be the easiest way.
Here, let me put this on again. Share. Oh wait, not yet. Hold on. I'm gonna put my last slide. Maybe people can jot it down. Maybe it's on. I don't know that I remembered to put it on the flyer. There. Siantz, my last name, Siantz, pronounced science, by the way, at utah.edu. So my last name is easy to remember what it is, hard to remember how it's spelled.
That's great. Dr. Siantz. Some appreciation for that. A lot of appreciation for your presentation, Liz, that it's an important topic and a wonderful presentation. This webinar will be recorded and posted on the BU Center for Psychiatric Rehabilitation website for those who want to see it later again. Will we provide a certificate? We don't have certificates of attendance for these, but thank you for attending. Okay, I think.
And I just want to thank everyone. I'm happy to continue the conversation. Please reach out over email. Yes, let's continue the conversation. So.
Thank you so much, Liz, and everyone participating who has to leave. There's a really short survey that will pop up as you leave, and if you could take a few minutes just to answer that, that would be great. And thank you all for your comments and suggestions. Really good group. So thank you.